A lot of you had to repeat that pharmacology quiz 2 and 3 times, so we really need to go over it. Question number 1, pretty much everybody got. Everybody did a great job. It was a simple definition question. We had no problems. But question number 2, let me just read it. It says, after administering penicillin G to a client, how long should the nurse observe the client to monitor for an allergic reaction? Now this seemed like a really simple question. It's just 30 minutes was what most people put for the answer. But I really wanted you guys to go deeper with these questions. So that's why I'm sharing my notes with you, so that you can see how I'm studying when I go through this homework. We have here what medication? We have penicillin G. What do you know about penicillin G? Did you just read that and go over it, look over it? Or did you stop and think, penicillin G. That is a penicillin. What is something we always have to do before we give a penicillin or any kind of antibiotics? What's the blood draw? What's the test that must be done? It's called a culture and a sensitivity. Culture and sensitivity. All right, write that down. The culture part is when you're trying to grow. You're trying to grow the fungus, the yeast, the disease, the bacteria that the patient has. Okay, and then you tested sensitivity, which means that you're looking to see what antibiotic is going to be most beneficial. So we know in this instance that penicillin G was prescribed. Now, allergic reactions, you guys all know, rash, itching, hives, okay? But in a priority situation, if you have a patient that is having an allergic reaction, what's your priority? Everybody says airway, fine. But what's the next priority after airway? Because everybody knows airway is a priority. Your next priority is notifying the physician, because you need to have new orders. You need another medication to stop the anaphylactic shock. Okay, so your first priority in allergic reaction is airway. The second one is notifying the doctor. All right. Now, for penicillin G, remember, we do not give this with birth control pills. All right. And one more thing that I had written down that I wanted to share is that when it comes to allergic reactions, the most common sign of an allergic reaction is a rash. So very good. Lisa hit mostly all those points on her homework.